CDC data shows the number of children contracting COVID is at an all-time high right now. And while most do recover with little trouble, we're also seeing the virus putting more kids in the hospital. 3-year-old Evie is one of them. In tonight's To Your Health, her family shares their story in hopes others take COVID seriously. Lily and Stephen enjoyed time with their grandparents' dog, Jasmine.
Jasmine is shedding.
But someone is missing from this picture.
I have always listened to my mom gut, and I knew something was wrong.
Their sister and Jasmine's best friend, Evelyn.
When she tried to sit up, she couldn't even hold her own head up. And then she laid down and she looked at me, she goes, "Mommy, I want to go home." Well, we were at home.
A day earlier, December 27th, celebrations for 3-year-old Evie's favorite holiday, Christmas, were cut short when she tested positive for COVID. Her parents, Morgan and Michael Igems, rushed her from their Topeka home to Children's Mercy in Kansas City, where she'd been treated for epilepsy a couple months earlier.
Her lips were white. She just didn't, she looked really sick.
As the week went on, Evie got worse.
She was just having a really hard time breathing, and she's just hurting.
She went from oxygen to CPAP and BiPAP machines, and finally a ventilator and ECMO, a device helping get oxygenated blood to her heart and lungs.
My thought was, why her? And we really thought she was gonna die.
Evie had brain swelling, a blood infection, and pneumonia in both lungs that ate away at her lung tissue.
We both just were so scared. And we kept talking to her, "Evie, you can do this. You're strong. We're here for you."
Evie's case is an extreme among children who get COVID.
It is a spectrum.
But it is a risk. Stormont Vale pediatric hospitalist Dr. Fuad Medlij says children with conditions like immune deficiencies, heart issues, and respiratory conditions are at higher risk. But he's also seen severe COVID illness in healthy kids, which is why he says everyone must take precautions.
You can't run the gamble by saying your kid's healthy. I'm just going to let him or her go wherever, do whatever without proper screening of the environment. Still have a life, enjoy your life, but make the hard choices and do what needs to be done, not what's convenient, so that virus doesn't keep piggybacking from one person to the other until it finds a susceptible host.
If you don't do it for yourself, at least do it for the people or even the children and the elderly.
Morgan and Michael were cautious. Both they and Lily and Stephen are vaccinated. They wear masks, sanitize, avoid crowds. Morgan tested positive just before Christmas and isolated with mild symptoms, only for Evie to follow.
My husband and I want to share the story to show how serious it can be for a child. I would never want anybody to have to go through this.
Evie spent nearly 2 weeks on the ventilator. She's still fighting infections and fevers, and half of one lung is now basically dead tissue. But the prognosis is positive.
They said she could live a happy, normal life. She might get winded quicker.
Evie expects to spend another 3 to 6 months in the hospital while her lungs heal. Until then, the Christmas tree remains standing, waiting for Evie to come back in the picture, back home.
She's a fighter. I'm just going to say that little girl's a fighter. She's strong.
The Igems and Dr. Medlij say keeping Evie and other kids, remember they're under 5, too young to get vaccinated, so keeping them safe takes everyone. They urge people to get vaccinated, and when kids or adults are sick, stay home and away from other people. There's a lot of faith in that family. Morgan started posting video updates on Facebook asking for prayers. She says the power of prayer is helping Evie recover, so she is so thankful for that. They have a long road ahead, though, so I have posted a link to a GoFundMe that folks have set up to help the family on WIBW.com. February is Heart Month, and tonight we share a story very close to our hearts here at WIBW. Last August, our friend and colleague Maggie Mahood suffered a massive heart attack. Her heart stopped. What happened next and what she's learned since are lessons we should all take to heart to perhaps one day save someone we love.
I'm very, very blessed, very fortunate.
Maggie Mahood says life had slowed for her the past several years, and she didn't even realize it.
When I was coaching or when I was in the car business, I would probably log in the 5 to 7 mile a day category. And I just became much more sedentary. I didn't exercise.
Should I call?
Maggie, an account executive for WIBW TV, still worked in the yard and kept busy with friends, but one day changed everything.
The day was August 20th of 2021, and I don't remember in any of it.
What is the last thing you remember about that day?
Picking up the newspaper on the driveway. And I brought the newspaper in to the house from the garage, turned around and collapsed. I remember being in the hospital room and my mom was there.
It was 7 days later.
It was obvious that we had a medical emergency.
Maggie's neighbors, Jane and Russ Green, can fill in the gap.
And Jane and I quickly went over to the house and saw Maggie on the floor.
A knock on the door from Maggie's friend alerted them something was wrong. Jane called 911.
She had stopped breathing. I checked her pulse. She had no pulse. At that time, because she had no pulse, we started CPR on her. And I did chest compressions and Jane did respirations.
Paramedics from Mission Township Fire Department arrived within minutes.
And she was shocked twice.
What was it like to see a friend in such distress and be able to put that aside?
I mean, I still see Maggie on that floor, and seeing Maggie get put into that ambulance and the EMTs driving away doing CPR on her, I just fell apart. And I think neither Russ nor I thought she was going to survive.
They'd later learn Maggie had suffered a heart attack due to 100% blockage in her left anterior descending artery, the major blood supply to the heart.
The highest chance of survival was 4 in 100, according to, it was generally between 1 and 4 in 100.
Were you dead?
Yeah.
Several of Maggie's doctors said to us that she would not have had the outcome that she had CPR not been started immediately.
Russ is a radiation oncologist who's certified in advanced cardiovascular life support. Jane, a pediatric nurse practitioner with basic life support training. But both stress it's training available to anyone and that everyone should have.
And oftentimes you take these courses thinking that you'll never end up using them.
Yeah, I think I took my first CPR course in my early 20s. You don't have to be a health professional to take a CPR class.
Once you know CPR for a friend, for yourself, know the signs. Maggie says she's learned, particularly for women, it's not the traditional chest pressure or radiating pain you might think. She had neither.
Friends told me I was tired. I had a great story about one of my friends gave me a mint because I was complaining of having what I thought was acid reflux. I thought I was tired and cranky.
In retrospect, knowing what you know now, were those some signs?
Probably, yes.
With 4 stents and rehab work, Maggie feels almost good as new. She's grateful for every day and every person who's made it possible.
It is very humbling. I had what I thought was a cabinet, a list of people that I thought would come if something happened, and they all came.
Well, Maggie's very easy to love. Both the Red Cross and American Heart Association offer that CPR training, and I have a link to information and their online videos demonstrating hands-only CPR on the health page of WIBW.com. Surviving her heart attack is only part of Maggie's story. You'll see how cardiac rehab is playing a vital role in her recovery and patients like her tomorrow on 13 News at 10.